Let me introduce myself. My name is Mark Rodriguez. I am the insurance team supervisor. I've been with public safety now for almost 3 years. I took over this position back in June. I look forward to working with all of you employers and everybody. So let's go ahead and get started. Looks like a storm is coming I'm going to be speaking on insurance cancer, and so let's start this. So I'm here to talk about the insurance options for the retirees. The retirees have options through the Public Safety Administration, along with ADOA, if they retire with ADOA, if they were with an ADOA employer. They also have COBRA or a private marketplace insurance. Retiree health insurance subsidy. Our retirees have the option to apply for subsidy if they retired from the Public Safety, Corp, ASRS, or EORP. The subsidy amount is based on the insurance coverage, retiree versus single, family versus single, or Medicare. For EORP members, after 5 years of credited service, they will qualify for subsidy. Who is eligible for subsidy? Tier 1 retirees, that's Tier 1, 2, and 3 DB members, public safety. Tier 1 and 2 DB retiree elective officials, and Tier 1 and 2 DB correction officers. Retiree DC public members, correction officers, if they opt in to contribute towards health insurance subsidy. What's new with the Tier 3 DC subsidies? Starting July 1st of 2022, DC members had the option to elect to contribute for health insurance subsidy. In order to elect for the subsidy, they had 90 days to make that election. New retirees of Corp and public safety DC members, they have 90 days to make this election to contribute. Contributions are non-refundable and they're also irrevocable. Retirees with 10 years of credited service and 55 years of age will be able to draw subsidy. TC, Tier 3 healthcare subsidy. Paycheck contributions are required to qualify for subsidy upon retirement. For fiscal year 2024, correction officers and public safety, the rate for the DC member is 0.17%. Subsidy amounts, it is based on their coverage type, single coverage, Medicare coverage. All this information can be found on our website under the health insurance. What's considered health insurance for these members? It's medical and dental are considered health insurance for these retirees for the purpose of receiving subsidy. Applying for subsidy with PSPRS, in order to apply for subsidy, the retiree needs to either apply for our coverage through public safety, which is administered through ASRS. Retirees can also enroll through the retiree program under ADOA. If they are enrolled in retiree with ADOA, they need to contact us, then we'll go ahead and contact ADOA for their health insurance information to send them subsidy. Also, current and former employers can send in a ER sub form to request subsidy from us. They let us know what insurance they have. We'll go ahead and send the subsidy over to the employers to apply to their premiums. Right here is the ER sub form. This can be found online through the employer forms. Just download it, fill it out. If you guys have any questions with this form, please feel free to contact us. My team is always happy to help employers complete this. Also with this form, please attach the local board minutes if you are requesting subsidy for a retiree return to work. In addition, retirees are eligible for multiple pension plans. For example, you might have a retiree who retired from public safety along with ASRS. These members we consider them double dippers. They can collect subsidy from both pension plans, or at times you may have a corp going into an EOR position. Again, they do qualify for double subsidy. Once a retiree becomes Medicare at 65, their subsidy amount does go down. That is based on age and Medicare eligibility. Retirees who return to work may qualify for a subsidy under the new employer if they meet the return to work criteria. My team's responsibility, I run the insurance department team. We're responsible for helping gather this information from the employees, from the employers, so we can apply the subsidy correctly to the members. We assist the retirees who contact our office to obtain this information if they have any questions, if they qualify, if they don't qualify. We help resolve any eligibility issues that are covered under ASRS plan. The employer's responsibility. We ask that the employers please complete the ER sub form, send us the approved board minutes, update any medical and dental rates. Whenever you guys have updated rates at the end of during fiscal year or in January, please send us the rates so we can update it on our records on our side. Also, if there's any changes with who we need to contact to help the members, please send that to us so we can keep our records updated. At the end of the month, I go ahead and my team sends out the subsidy checks along with the subsidy reports. We send those to you. If you see any conflict in those, please give us a call and we'll reconcile them. Maybe the rates might be off, maybe the employer termed. Maybe you see an employee that you hired that's a return to work and you don't see them on the report, give us a call, please. Rather help these members right away so they're not coming back a year later asking for retro coverage, retro subsidy. My contact information for my team. Again, we're always here to help. We're here for the employees. We're also here to help you guys get everything straight so there's no issues. Now for the cancer insurance. The cancer insurance is available for public safety members and retirees along with correction officers if they elected the plan. It is not available to the elective official plan. Currently have over 3,000 active members and retirees, first responders, and correction officers. Right now we are distributing approximately over $3 million a year in benefits to these members. The employer's responsibility. Just ensure, come July, we send out the annual invoices. Prior to July, online, you can check your rosters to make sure all your employees are active. So please check those rosters before July. Invoices do go out in July. Come the end of August, interest penalties are applied to those. Correction employers, please provide us all the new hires that are opted in. I'll go ahead and send out an invoice to all the employers in July. Who's eligible for these programs? All active members, public safety retiree members who have not exhausted the 5-month grace period are covered every year for every credited service year of active duty, including drop. Retired members who have exhausted at no cost pay period continue coverage if they have filled previous cancer diagnosis claim and continue to pay their annual premiums. Correction officers who's covered under the correction officer plan. Again, if they elected at the time of hire or during open enrollment to take the cancer plan and have been paying their annual premiums. The retirees are also eligible. 5 months of coverage they do receive for every credited year of active service they've provided. Also, along with retirees, if they did provide a diagnostic cancer claim that has been paid and processed, they will be able to extend the coverage after their grace period. The cancer diagnosis plan benefits. For the first diagnosis claim, we're paying $15,000. It's very important that these members do understand that they are eligible for this benefit. I'm hearing a lot of members, once they retire, they didn't realize the benefit's there. It's a very good benefit to help them cover their cancer claims. For their second diagnosis, as long as it's a separate one, the benefit is $7,500. We do pay genetic testing. We reimburse for medical imaging, screening, radiation, and chemotherapy, and out-of-pocket expenses that may occur. That's only for pharmacy. For skin cancer diagnosis, right now we are reimbursing $500 per incident, up to 5 lesions. Right now, cancer claims are getting processed between 4 to 6 weeks. Once we receive them, claims come in, my team will go ahead and, if they come in by mail, my team will go ahead and respond to the email, let the representative know, let the member know that we received the claim and it is getting in process. As long as the claim is clean, the member should be receiving the check of the benefits within 4 to 6 weeks. If the member has any questions or needs to file a claim, doesn't know how to file a claim, they're welcome to give us a call. They can also email my department. Right now, public safety, in the past, public safety was paying these benefits for the public safety members straight to the employers. We'd be sending out the payments to the employers with the W-2s. The employer was responsible for running this through the member's payroll. If the member is retired, the employer would need to go ahead and run this through the payroll so they can gather the proper taxes. Tax withholding forms will be included. It's considered a fringe benefit and is not a pensionable wage. Lastly, remember, claim payment changes impact the public safety members, not the members of Corp. In other words, Corp members had to pay the benefits at the time, so that was not taxed. But as of September 24th, legislation has changed, SB 1084. Come January, all cancer benefit payments, all premium payments are considered a benefit and are taxed accordingly. When these active members send in payments, what we're doing right now is 2/3 of these payments are going over to the employers, 1/3 is going straight to the members, non-taxable. And come 2025, 100% of these cancer benefit payments will be going to the members, 100% non-taxable. If you guys have any questions, please feel free to visit the website. Also, my team is always available for answers and questions along with myself. I'm happy to work with you guys. I'm all about communication. Questions?
When was it made effective that the local board minutes were required for the submission of the ER-SUB?
It has always been required according to statute.
Oh, okay.
Yeah, whenever a retiree returns to work, the board minutes are required just so we can know their position they're hired and to see if an ACR contribution is required.
Thank you.
So, does this benefit applies for any type of cancer?
Yes, any positive cancer diagnosis.
Okay, thank you.
Thank you.